Hey there, welcome to our channel. Hope you are doing well. In today's video, we're going to be talking about the drug, which is a neurotransmitter naturally produced in our body. This is a neurotransmitter made in your brain. It plays a role as a reward center and in many body functions, including memory, movement, motivation, mood, it is associated with diseases including Parkinson's disease and attention deficit hyperactivity disorder. You may have already guessed that we are talking about dopamine here. Now, you may have heard the term dopamine before, but what exactly is it? Well, dopamine is a neurotransmitter that is a naturally occurring catecholamine neurotransmitter and hormone. It causes blood vessels to relax at low doses or constrict at high doses. It acts as a vasoconstrictor. It also plays a big role in how we feel pleasure and reward. It's often referred as the feel-good chemical, because it's released when we experience something enjoyable, like eating delicious food or engaging in activities we love. That was all about naturally occurring dopamine in our body, but it is also used as the emergency drug. Next up, we will see the uses of drug dopamine in clinical practice. Dopamine is primarily used as a cardiovascular medication in critical care settings. Its uses includes management of shock, particularly in cases of cardiogenic shock, septic shock, or hypovolemic shock, to improve cardiac output and maintain blood pressure. It is used in heart failure to increase cardiac output, but how does it work? Dopamine's effects depend on the dose administered, as it acts on different receptors at varying concentrations. Dopamine acts on multiple receptors, mainly two types: dopaminergic receptors and adrenergic receptors. Dopaminergic receptors are mainly D1 and D2, and adrenergic receptors are alpha-1 and beta-1. The sensitivity of dopamine to these receptors are different for both receptors. The dopaminergic receptors are more sensitive, hence are stimulated easily, and adrenergic receptors are less sensitive and require high dose of dopamine to get stimulated. That is why effects of dopamine are different at different doses. At low doses, it stimulates only D1 receptors, which causes vasodilation and increased glomerular filtration rate. At moderate doses, it stimulates beta-1 receptors and increases the force of contractions, and also cause vasoconstriction at high dose. Results in increased systemic vascular resistance and blood pressure. This is how dopamine is used. Just like any other drug, dopamine also has some side effects which we need to consider. The side effects of dopamine are dose-dependent and related to its pharmacologic actions, which includes effects on cardiovascular systems such as tachycardia, hypertension, and arrhythmias. In neurological side effects, headache, anxiety, and tremors can occur. Excessive vasoconstriction can lead to ischemia in peripheral tissues. Moreover, there are certain medications that can decrease the levels of dopamine in our brains. For example, antipsychotic medications are used to treat conditions like schizophrenia by blocking the action of dopamine in certain parts of the brain. In conclusion, dopamine is an important medicine in emergency to restore heart activity and maintain blood pressure. If you found this video informative, please like, share, and subscribe to our channel for more content. Thanks for watching.